Hello and welcome to another Boston BioLife webinar. Today we'll be discussing a very popular topic from the world of cosmetic regenerative aesthetics, PDO threading. PDO stands for polydioxone and is a synthetic organic polymer that is used historically as a medical suture. However, it's finding new utilization in the world of aesthetics. Today we are joined by the owner and founder of PDO Max, Giovanna McCarthy, and she'll be describing the science behind PDO threads, their clinical application. So Giovanna, thank you so much for being here today with us. We appreciate your time. We look forward to learning more about PDO threading and PDO Max.
Hi, Joe, and thank you, Boston BioLife, for having me on. We are going to be discussing PDO thread training didactic. We will be discussing PDO Max and the company. What are PDO threads? About PDO threads and which cannulas and needles work. PDO thread effect, indication, cannula comparisons, 4 best results, contraindications, pre-treatment, post-treatment, treatment protocol, treatment areas and pricing. Before and after photos are also here. About us and our company, my name is Giovanna McCarthy. I have been in the skincare business for over 30 years. I am a licensed cosmetologist with an aesthetic medical certifications, and I'm certified and have lectured on the use of commonly available laser systems for skincare. I have collaborated with plastic surgeons and dermatologists in the greater Syracuse area for the past 15 years. My expertise of skincare and I have the unique ability to know what products and services will do really well in the aesthetic realm for the patient and the physician. I have branched out into medical devices with PDO Max and PDO threads and lipofilling kits. I travel around the world and the country training people on sharp light laser trainings and PDO thread lifting procedures. About the company, PDO Max Threads, formerly known as Rejuvenate, is a trusted provider for hundreds of medical practices utilizing FDA-cleared polydioxonone threads in cannula in medical aesthetic practices. We have an FDA-cleared PDO Max threads. They can help you grow your practice with training and device support. PDO Max offers both group and individual trainings, and we also have a partnership with a few schools in the PDO technique. Our focus is on the science of beauty and the most effective way to restore indicators of health using non-invasive techniques. Polydioxonone is a strong synthetic monofilament fiber consisting of one solid fiber of thread. It absorbs in 4 to 6 months, depending on the thickness of the thread. PDO is colorless, biodegradable synthetic polymer. It has been used in cutaneous and subcutaneous suture material in plastic surgery, cardiology, traumatology, and gynecology for more than 30 years. What are PDO threads? PDO threads have high flexibility and elasticity and durability. They have better resistance and elasticity than all other absorbable synthetic threads. Absorption is by hydrolysis. H2O and CO2 are released in the mildly exothermic reaction. Total thread absorption occurs within 180 days from time of implantation. PDO and cannulas and needles. The PDO needle or cannula is made of a special steel that is laser sharp and flexible, which allows for unique control as the needle is inserted. The PDO thread is loaded into the needle or cannula, and a very small portion of the thread protrudes out of the distal end and is held in place by a sponge that wraps around the needle. The sponge holds the thread in position while the needle or cannula is inserted into the skin. Once the entire length of the needle has been inserted, gentle pressure is applied to the distal end from the outside of the skin and holds the thread inside the needle is withdrawn. PDO threads and its effects. Healing from trauma and absorption generates neocollagenesis of the skin. It creates a mild fibrosis as new bands which strengthen the connective tissue of the skin. Smooth threads can be inserted in a mesh pattern to create a scaffolding for support. Barbed threads can mildly lift and reposition skin. The effects of skin repositioning and swelling may be seen immediately. Results can be reassessed after 1 to 2 weeks and thereafter. PDO threads effects. Some of the effects you start seeing are wrinkles start to smooth, pores narrow. Skin becomes more elastic and improved texture is seen. Skin improvements over the next 4 to 6 months and lifting is noticeable. The final result can be seen for 12 to 24 months or more depending on patient's age, level of metabolic activity of the cells and the skin. Indications for the face. The product can be used in cheeks, jowls, smoker lines, in the jaw, in the vermilion border and cupid's bow, in the neck, in the under eye area, in the eyebrow area, the nose, the nasolabial folds, and crow's feet. Indications for body use. It can be used in breasts, buttocks, knees, abdomen, legs, and arms. There are a few different types of cannulas. There's the L cannula, the blunt cannula, the dull cannula, and the sharp cannula. PDO Max as a company has used the L-shaped cannula. It is one of the easier cannulas to get through the tissue with the least amount of pain. We stay away from the sharp cannula, being that it causes a lot of bleeding, which causes tumescence and doesn't allow the thread to necessarily grasp. The sharp cannula seen here, this is the one we definitely stay away from. We do use the sharp cannulas in the small thin threads because there are little small needles that stay very superficial. Picture of the dull cannula. You can see why we have chosen not to use this. This is pretty harsh to get through the tissue. The blunt cannula is another one we chose not to use. It just takes a little more force to go through the tissue, and you need a bigger introductory hole to get a blunt cannula in. And here's the L-shaped cannula. As you can see, the L-shaped is almost like a half of a blunt. It is why we have chosen as a company to use an L-shaped cannula. It is very easy to introduce, goes through the tissue much easier than a blunt, and causes less trauma than a sharp. For best results, the age of people that we should be using threads on, ages 25 to 35, it's great for preventing skin aging, and ages 35 to 75 for treatment of skin aging also. Best results are achieved with mid-age patients, people that don't have a lot of laxity, skin that is not too thick or too heavy, and no dermatological diseases. Contraindications: immune diseases, pregnancy, coagulation diseases, cutaneous neurofibromatosis, various acute infections, influenza, any kind of fever, oncology, tendency toward keloid scarring, inflammation of the skin in areas to be treated, neurotic psychological disorder, unrealistic expectations. Pre-treatment care. You really want to avoid aspirin, vitamin D, NSAIDs for up to 10 days prior, just to prevent bruising. Avoid alcohol 3 days prior to procedure, also for lessening bruising. Oral antibiotics are recommended by some practitioners for introduction of over 100 threads for 5 days prior to treatment. Valtrex, 2 grams a day before morning, of then 2 grams 12 hours after first dose for patients with more than 4 to 6 outbreaks per year. Post-treatment recommendation: arnica and vitamin K may be applied after procedure for 5 to 7 days to help minimize bruising. Microcurrent and cold compresses only if necessary for 10 minutes. Avoid baths. Avoid active sports for 1 week. Avoid facial massage for 1 month. Avoid laser, IPL, RF, and other energy treatments for up to a month. PDO protocol for procedures. Photos should be taken before the procedure. Map area to be treated while patient is sitting up. Take photo of that mapping. Topical anesthetic or local infiltration. Disinfect treatment area well before procedure. Treat area. Introduce the threads. Disinfect area after finished. You can apply arnica or vitamin K immediately after. Cold compress and take a picture of your post-procedure. This is a mapping of where the threads can be used and the sizing that can be used in those areas. A good all-over indication of what you can be charging for these thread procedures.
So here's what we're using for the thread lifting. I'm sorry. I'm using the 19 gauge 100 millimeter.
Can you turn the package around? Yeah, so it's the Rejuvenate
Yes.
threads. They're made out of polydioxanone,
Absorbable suture. Yes.
heavy metal free.
And then there's a date on the back of these. They're good for life. So what I'm going to do first here is I'm going to use the lidocaine with the epi. So I use 2% lidocaine with the epi to control the bleeding.
How many cc?
Inject a half a cc at each injection point. Fabulous. You're already looking fabulous.
Do I look 4 years younger?
Already. So when you're doing this, so what we're talking about doing with the threads is lifting this. Sit real straight up there, Miss Stephanie. And she's got just a little bit of this right here. So I think we need to do at least 3 on each side. So we're going to pull up and back, and then this little jowly area needs to come up. And so by doing that, it's going to give her this nice smooth look. Now see these, can you see all these little acne things? That's what we're going to use the exosome and the PRP stuff. So when you're doing the threads, you have to be careful because as you know, there's a big artery going in right down in front of the ear. So you want to make sure and stay away from that. So I generally go right around the hairline just and do a bleb, and of course you'll aspirate, so you want to make sure you're away from that artery. Did that scare you?
No, I mean, I completely
kidding.
trust you.
I know, I'm just kidding you. All right, so, and I'm using a 30 gauge 1/2 inch needle, and we're just going, no blood, so we're just going to inject about a 1/2 cc, and just bleb it right there. And then that will turn white due to that epi. And I just numb it because I'm going to use an 18 gauge needle and I don't want her to feel the prick. So right where we put the lidocaine is where we're going to make the little hole with the 18 gauge needle. Now, we know we're not in a vessel because we have no blood coming back, so that's a good thing. We're going to bathe the thread in exosomes.
Let me see if I can zoom in on.
So it's a hollow catheter and there's a thread inside of it, and at the very end it's open and there's a little spoon scoop on the end. So I'm going to put the exosomes in at the top where the thread is, a couple of drops, and it runs down the thread and the thread absorbs it, and then I put it into her face. So it makes the results fantastic.
Yeah, as you can see on the end there, it has a little bit of a lip up so that the liquid doesn't just all spill out.
So I'm going to, this is the 1 cc of exosomes. So I'm going to put just a little bit in. So I can see at the end there's a little liquid, so I know that it is bathed the thread all the way down. So now the thread, you can see where the end of it is right here. So it's going to pull her little jowl up. You doing okay?
Mm-hmm.
Did that hurt?
No.
Now when you take it out, it will leave the thread in there, so. This thread has little teeth on it, and so I'm just popping those little teeth out. Then you can pull on the thread and see how it's anchored in there.
Correct.
See there? Nice, very nice. Now we're just gonna leave it till we get them all in.
When she rubs it, Stephanie, do you feel anything?
No, I don't feel anything.
Hole, and we're gonna aim for right here. Now see where we're at? The corner of her mouth.
Mm-hmm.
Which is right where we want to be. You feel
Can
that
you
little?
penetrate the other side? Come out into the lip by accidentally?
No, because it's a cannula and it is not a sharp. It's not sharp
Okay,
on
it's
the
not
end.
sharp, okay.
No, sir. So, and you can see where we have that one. We have them both now pulling this whole area up, and we're going to aim for right here with the third one. Now we ended up right here at the nasolabial fold. Now, you don't want to get too close to this area right here, even with a cannula, because you know you got a lot of vessels coming out. So I usually aim just right below it. And when you're rubbing it, you can feel the little teeth kind of pop out. Do you feel that, Stephanie, a little bit? You feel that popping?
Yeah.
Now, like tonight, when you yawn or stretch or something, you may feel another pop. And I've had patients say, oh, I think I broke my thread. It popped after I left. That's just more of the little teeth popping out. So now she's got a nice little lift here. So Dr. Travis has got this nice little kit here that you need to have with your threads, and it's got some surgical scissors in it and a couple other little things. So you know, flip it around, let him see the front of it. Just a little suture removal kit. And so I just take the little sterile scissors and
That's it? You just cut it? No knots, nothing?
nope, that's it. Got a little bit of scar tissue in there.
Is that what you're encountering? You think a little scar tissue?
Yep, from the acne scarring. So it's a little bit, you can feel just a little bit of resistance, and I can see that she's got some acne scarring in here. So, and I'm in the subdermal, so that's just a little bit of acne scarring resistance. You just have to push through it.
But did she feel pain? She was
She probably,
Yeah.
she felt a little bit because of that acne scarring. But see where we're at? We're right here. So out. She's got a little bit more acne scarring on this side than she does on the other side. Just take a deep breath and relax. Perfect.
That one wasn't as bad as.
No, because I was a little higher and we were away from most of that acne scarring. So, and that's pretty much it, other than you just adjust it back and pull it nice and tight. And then we're just gonna clip it. And when you clip it, you wanna pull up and push down. You don't want any threads outside.
How do you?
How do I do it? I do it as I look at it. And say I got one side tighter than the other, I would just pop another thread in and pull it up. Make it equal. But hers looks very good. Very nice.
Awesome.
And here are some before and after photos. This person had had facial paralysis for quite a few years. The practitioner treated one half of the face with our threads, a great indication of how well these threads do lift. These are smooth threads under the eyes. This is a person that was treated with threads and filler. Her cheeks were lifted, her jaw was lifted back, smooth threads under the eyes, and filler in the cheek area. This one also had some cheek filler and threads, smooth threads to smooth out the area of skin irregularity, and lifting threads to tighten up that cheek and jawline. This is a woman with sun-damaged skin. As you can see, we did a lot of smooth threads in her arms on 2 separate occasions, and you can see how much smoother that skin is. PDO benefits and conclusion. Polydioxanone is safe, non-toxic suture used for over 30 years. It has preventative and healing abilities, can be used in patients who do not want surgery, neurotoxin, or fillers. Procedure is usually quick, 30 to 45 minutes for a full facelift. Side effects are mild and recovery time is short. Formation of collagen gives long-lasting effects. It's a very natural look, can be used as both alternative to plastic surgery or fillers or in conjunction with. It's a great product to use in conjunction with other procedures.
Giovanna, thank you so much for that very informative presentation on PDO threading. I understand you have an upcoming course in Las Vegas on March 11th through the 14th with R3 Medical, where you'll be teaching not only the science of PDO threading, but actually hands-on applications. And Boston BioLife members are able to get a $500 discount to this course and a complimentary badge for their admin. For more information on our website, Boston BioLife is proud to be collaborating with other education providers that have a complete spectrum of training opportunities, from hands-on training to didactic, the science behind the clinical practices of regenerative medicine, but also the clinical applications as well. So please feel free to utilize this very important resource. Members for our programs receive discounts to these events, as well as other valuable tools.